Hi friends, my name is Dr. Sunil Sable. I'm a pediatric neurologist and practicing at Ahmednagar, Maharashtra, India. And today I'm going to discuss about epilepsy. What is epilepsy? What are the types of epilepsy? What are the causes of epilepsy? How to diagnose epilepsy and how to treat it? Now, dear friends, our brain consists of billions of cells called as neurons. They're connected with each other and they communicate with each other with the help of electric signals. If everything is going on smooth, then our activity, our life is smooth. But if there is excessive and abnormal electrical activity of the cerebral neuron, then it produces the convulsion or what we call as fits. So this convulsion is because of abnormal and excessive electrical activity of the brain. Now, there are predominantly two types of seizures. One we call as focal seizures and one is generalized seizures. In focal seizures, a particular part of the body throws seizures, and in generalized seizures, whole body throws seizures. Now, there are other subtypes of generalized seizures like absence seizures, in which the child or person lose awareness for a few seconds. There's certain types of seizures called as myoclonic seizures, when there is sudden jerks of the body. Certain seizures in which there's a drop attack or infantile spasm. There are certain types of seizures in which just the child lose consciousness or awareness, then he will do some movements of hand, and it may last for a few minutes. It's called as complex partial seizures or focal seizures with impaired awareness. So there are various causes, types of seizures. Now, what are the causes of seizures? Now, the seizures occur because of two things. One, there may be a damage to your brain, which is called as symptomatic seizures, or it may be genetic seizures. Now, the damage to the brain may occur when there is a complicated delivery, there is a low birth weight, if there is an intrauterine growth retardation, a prematurity, if baby do not cry immediately after birth, if baby develop brain infection called meningitis or cerebral hemorrhage, if there is a traumatic brain injury and there is a damage to the brain. So any things which causes damage to the brain may produce seizures immediately or later on. If there is a tumor in the brain, it may cause. If there is a structural problem in the brain, it may cause seizures. Some children from 6 months to 5 years may develop seizures during fever called as febrile seizure. So these are various causes of seizures. Now, how to diagnose seizures? The first and foremost important test is EEG. It is called as electroencephalogram. It records the electrical activity of brain, and it tells you if there is a seizures, what type of seizures. So seizures can be diagnosed with help of EEG. The other test the doctor may advise according to the patient's, means on individual level, the imaging of the brain, predominantly MRI of the brain. If he feels that there is some calcium deficiency, magnesium deficiency, which may cause seizures, then he may advise some blood test. If there is any suspicion of some brain infection, then he may advise lumbar puncture test. And if there is some genetic, then he may advise some genetic test. So once the patient is diagnosed as epilepsy, now epilepsy is a disorder when there is a tendency of having frequent unprovoked seizures. If doctor feels that this patient is suffering from epilepsy, then the doctor will start anti-epileptic medication to prevent seizures. Okay, and these medications are continued for at least 2 to 4 years, depending upon the type of seizures. Okay, so during this period, if there is no seizures, then the doctors after 2 to 4 years will try to taper and omit the medication. When you are on medication, you should be in a regular follow-up with the patient and doctors to see whether there is any adverse effect to the drug. Usually 70 to 80% of the people can be controlled with these anti-epileptic medications, and over a period of the time they may get cured, what we call as a remission. Okay. And unfortunately 20 to 30% of the patient may not respond to this anti-epileptic drug, for which there is other modality of treatment like ketogenic diet and epilepsy surgery is also available. Now, if some persons or child throws seizures, so what are the first aid why should give that the particular person? So if the person is having convulsion, you have to keep that person in a safe place. You have to make him lie down, turn to the one side. So do not put anything in the mouth. Do not put any spoon or any handkerchief or your finger. Do not try to open the clenching of the teeth. Even if the person is biting his tongue, do not try to open it. Okay, just loose his clothes. If there is a very tight clothing, you should make it loose. If he is having convulsion, do not try to hold the hand and stop it. Do not gather around that particular patient, and do not put anything in mouth. Now, if you do this, most of the seizures are controlled within 2 to 3 minutes. If the seizure do not control over a period of 5 minutes, then you have to shift this patient to the hospital. There are certain medications which are now available with the help of nasal spray, which will control the seizures and can be used at home. Okay, so if proper medications are taken, then this patient can lead normal life. Now, there are certain misconceptions about epilepsy. That what are the misconceptions? First, the epilepsy is contagious. No, it is not contagious. Second thing, the epilepsy is because of the sin committed in previous life. So no, it is a brain disorder. Okay, it's a chronic brain disorder. Third misconception is that the patient with epilepsy cannot marry, cannot have a normal life. No, it's wrong. The patient with epilepsy have a normal life, they can lead normal life, they can have children as well. The need of the hour is to diagnose this patient, these children as early as possible, take them to the doctor, and if the doctor thinks that this patient has epilepsy, start the treatment. And with the treatment, these people can lead very normal life. So dear friend, I hope you like this lecture. If you have any doubt, you can mail me, you can write in the comment box. And thank you so much for watching this video. Thank you so much.